64% of adults have experienced childhood trauma, also known as Adverse Childhood Experience, or ACEs. Research shows that individuals who experience multiple ACEs are more likely to suffer from a variety of illnesses, like chronic respiratory disease, cancer, heart disease, liver disease, or obesity. Although trauma survivors are more likely to need medical services, they may be less likely to seek care because medical procedures can be invasive and frightening. It is important for healthcare providers to utilize trauma-informed practices to help their patients feel safe and accepting of medical care. So what does it mean to be trauma-informed? And what does a trauma-informed transformation look like? The Coalition for Trauma-Informed Transformation is a learning collaborative designed to promote the understanding of ACEs. The Coalition will plant seeds of awareness and nurture organizations to grow into champions of trauma-informed care. As a member of this coalition, you will receive expert consultation and support to begin your organization's trauma-informed transformation. Trauma transformation begins with the understanding that everyone you meet is potentially struggling with a history of trauma. By planting these ideas in your organization, your employees learn how to manage traumatic stress, create safe spaces, and approach their work in a way that prevents re-traumatization. As this seed grows, it will stabilize your workforce, improve service delivery, and eventually transform your practice. The Coalition will help your organization develop roots in the community, identifying resources and partners to create life-giving networks that increase trust, improve service accessibility, engage the underserved, stabilize lives, and prevent social erosion. Your practice will undergo a fundamental transformation as strategic goals, management practices, and performance outcomes are influenced by principles of trauma-informed care. Stakeholder feedback will guide your organization's growth to ensure services address the lasting effects of trauma in your community. A trauma-informed transformation will not only improve your organization's service outcomes, but also the outcomes of the people it supports. A trauma-informed organization provides life-sustaining oxygen to the community by improving wellness, building resiliency, and increasing individual and communal functioning. As a trauma-informed practice, you can reduce the lasting effects of ACEs and toxic stress on your community. When you join the Coalition for Trauma-Informed Transformation, you will receive training, resources, expert consultation, and collaborative support to learn how to grow from trauma-aware to trauma-responsive to becoming trauma-strategic. Working together, we can transform ourselves, our organizations, and the communities we serve. Our trauma-informed trees have the potential to grow into a forest, changing the climate of our communities.